Hi, everyone. This is Emma. I am the Development and Communication Coordinator for WalkMass. This is our September edition. We have Jessica and Enrique here today. Enrique works at Mill City Grows, and Jessica used to be the Executive Director at Mill City Grows. We are going to be speaking today about walkability and food sovereignty. Jessica, you are welcome to start.
All right, thank you. Just give me a moment. I'll get my beautiful slides up so everybody can see. So welcome to our Enrique and I's first talk ever on walkability and its impact on food sovereignty. First, we wanted to introduce ourselves a little bit. So my name is Jessica Wilson. I am the former Mill City Grows founding board president and executive director. And for those of you who don't know, Mill City Grows is a food justice organization in Lowell, Massachusetts. We started, I think about 11 or 12 years ago as one community garden. And since then, we have Mill City Grows has expanded to include a variety of food justice programs, including community gardens, school gardens, a mobile market, and food education programs as well. And I'll let Enrique introduce himself too.
Yeah. Hi, I'm Enrique Vargas. I'm the Associate Director at Mill City Grows, but I'm also a food policy advocate for the organization, actually, which we just started doing in the last couple of years. But, I've been working in the organization from the farm. I started as a farmer and market, and then I worked at the community garden program. And now I'm mostly focusing on the advocacy side of things through MCG, which like I said, we started doing like a couple years ago after like a 10th anniversary. So
wonderful, awesome. And so if folks have any questions at all about Mill City Grows programming, we'll discuss that a little bit more later on, but we're happy to talk more about that as well. So I first, wanted to make sure we're all kind of aware of similar terms when we're talking about food and kind of the food justice, food access sphere, and ask this question, like, when we talk about food, what are we talking about and who's telling this story? And so, one of the I think primary ways that these food terms are determined and funding gets allocated and conversations get made is at the federal level. And so what you're looking at right here is the USDA Food Environment Atlas. And if you've heard terms like food deserts, this is where this comes from. And I think it's important to think about this in terms of not just food, but also geography, walkability, transportation, because these terms come from a combination of things. So if we talk about like all these places where you see it's red, these are considered low income, low access points on this map. And what that means is that 1/3 of the population in this space lives at or below the poverty level, or 80% below the median income from that area. And in addition, 1/3 of that population lives, if it's an urban area, they live more than a half mile from a place where they can buy food, a grocery store, or more than 10 miles if it's a rural area. So this definition, when we're talking about food access and we're talking about food insecurity, it really is a combination of, what people can afford and how far they are from their food source. And I think at the last survey that was taken, which may have been a year or two ago, there are 53.6 million US residents, or just over 17% of the population that fall into these, these red zones, the low income, low access communities, which historically we would call food deserts, was the term that was coined when the USDA gave us this map. But there's some different terms that we're going to share with you to talk about how we like to talk about it now. So Enrique, I didn't know if you want to tell us a little bit about what we're seeing here. So this is drilling down to the Lowell community, which we're going to talk about in a little more depth.
Yeah, so basically, when you look at this picture, this image, this map of Lowell, and these are the dots are food, where places where you can get food. They're divided by different type of type of store, for example, you know what I mean? So there's like the pharmacies, supermarkets, and just like meat markets, you know, dollar store, et cetera, et cetera. And you can tell just by that, like the vast majority of food access points tend to be like bodegas and like drugstore type places versus like supermarkets, which are a lot less. But one of the things that I wanted to point out when you look at this picture here, you know, you can clearly see the river right in the middle. And it's actually like the river in Lowell is like a kind of crazy like access point for people. Like we actually say the other side of the river because it's pretty much inaccessible for certain groups of people to just like cross the river because it's kind of far away. There's always a lot of traffic. There's like lack of transportation to get there. And if you're gonna go on foot, it just takes forever and everything's kind of like even more spread out. That's actually like the more rural side of Lowell. But if you see like the bottom part, like the southern part of Lowell, it's like where mostly all the people live. That's kind of the most populated area. But you still see like it's mostly predominated by convenience stores and everything. There are some supermarkets and everything that are like very community focused. So there's like, you know, the Asian supermarkets, Greek supermarket, but they're also not like big spaces. Some of these markets are, you know, like stores pretty much, like not like an actual full-on supermarket and that. But these are the locations of most food access points in the city of Lowell.
Thank you so much. And I think, you know, one visual that we're missing, but I think when we saw this was really telling, is that there's these kind of big open spaces where there's not as many food access points. And when we took a look at the public transportation map of Lowell, there were also like a lot of areas where we don't see food stores, but there's also no coverage for public transportation. So those folks are really the furthest distance from a place where they would be able to get food. So even in a community where there are many food access points, as you can see on the map, the ability to get to places where fresh, healthy food is located, particularly if you don't have access to a vehicle or money for ride shares or things like that, is really, there's still a lot of people who are within those like low access areas. Okay. So we wanted to talk about a few more terms that we use when we're doing our food justice work at Mill City Grows. And so we think about, you know, the term itself, food justice. And this was part of our mission statement when Mill City Grows was formed over a decade ago. And the goal there is thinking that, you know, having access to not just any food, but food that supports your cultural heritage, that supports your health, is a human right for all people. And so that as a food justice organization, we are advocating for that access to fresh, healthy food that is culturally connected. And we're also advocating for the well-being and safety of everybody who brings that food to the consumer. Food sovereignty is a little bit different and kind of a further step in that direction. So we're not just talking about how food is a human right, but also that, you know, as a community, we believe that people should have a say in how that food is created, how it gets to the table, and have some control over, you know, what is available to them in that space. And that we are always thinking about ways that food can be produced that increases sustainability, that increases safety, that increases human and animal welfare, and the health of the earth. Enrique, I don't know if you wanted to talk a little bit more about like culturally connected or the other terms are,
yeah, of course. You know, on the culturally connected part, like the best way I describe it is like eating also the food that you're like familiar with growing up, you know, or like your culture kind of like it's all about. Like, for example, when I first came here, a lot of people were telling me, hey, do you want you know, you should be eating a lot more kale because that's good for you. And I'm like, yeah, that's cool, but I don't eat kale. Like that's nothing. I don't know what plate. I just learned about kale just now. Thank you for telling me about that. You know, I like my plantains, you know, that's what I grew up eating, you know. So that's kind of like part of like the cultural connection, you know, you want the food that is healthy for you, like ecologically sustainable, that everything in the food system kind of brings it to you, but also that you're connected with it and all that. And I mean, that also kind of like touches on the regional and local parts. I mean, obviously some of those foods, I mean, I'm from the Caribbean, not all those things do grow up in this area, but we also want to make sure that the food that we do get, for example, in our markets and all that, comes very locally. Like we have like a 30-mile radius, you know, for local sources. I mean, we only have a 4-acre farm and all that. So obviously we're not able to grow everything to like sustain the whole of city, obviously. So, you know, we have some vendors that we get from, and they're all, you know, no further away than 30 miles. And a lot of farmers from like Drake and the local area when it comes to that. And even though we sometimes do bring like things, you know, like avocados and all that, we also make sure that they are very well, you know, connected, and it's not exploitative on the process to get here to where we are too.
Thank you. So in 2021, Mill City Grows completed a community food assessment. This was a community-wide study. It was the second one of its kind that we had done in Lowell. And one of the reasons we conducted it was Mill City Grows was celebrating 10 years of bringing a variety of food access programs to the community. And we also wanted to see what had changed in the wake of the COVID-19 pandemic, which, as we all know, really changed a lot of things in terms of multiple systems. But I think the food system was the place where most people in this country felt the impact pretty greatly. So when we conducted this community food assessment, and it's currently published on the Mill City Grows website, which is millcitygrows.org, so you can read the entire thing if you want to, and learn a little bit about how we did it. But our goal was to make sure that we captured the voice of every group of people in the community, particularly those who are most impacted by food insecurity. And so there was a steering committee that consisted of, you know, folks who were under 18, elderly folks, folks who spoke different languages from the immigrant community, and then people who worked in the food processing and service industries as well. So some of the main things that we learned when we talked to our community was that the top thing that everybody was looking for was that food be close by, convenient, and time conscious. So over a 28% of respondents, that was the highest group, and that was the big thing that they're looking for every time they purchase food. Of the barriers to food access, affordability, I think across the board is usually number one, but number two is travel distance. And so people stated either there was not enough stores close by, or they lacked transportation to get to the store that they wanted to buy the food that they were looking for. So that still remains, you know, really high in terms of people's issues with food security. Then we talked further to people about how do you get to the store? How do you get your food? And so the majority of folks did use a car to get to a store, no matter how close or far they lived from that store. But for those without a car, they would either walk, use the bus or public transportation, take a taxi, or get a ride from others. More than half of them reported they don't usually have enough money to buy food, and they report spending 1.5 to 2 times more time on shopping and obtaining food for their family. So when they don't have access, when folks didn't have access to transportation, or when they were using, you know, transportation that they didn't have control over, this is impacting the amount of spending power that they have at the store, and it's also impacting their quality of life in terms of the amount of time it's taking them to get that food. Every question we asked across the board also just wanted to make really clear there are racial disparities among all the residents of Lowell. So BIPOC residents were, in general, 10 to 30% reported more difficulty in terms of accessing food with every question that we asked, but particularly with this one around transportation. And then this one, so we dove into some of these questions and talked about like the responses and some of the recommendations. And Enrique, I'll let you tell us a little bit about what we see here.
Yeah, so from the questions that we were asking people, you know, like how did they rely to get food? A lot of people, yeah, like I said, they go on cars, but a lot of the times they ask for a family member or a friend to bring them to the supermarket. And you know, that, like Jessica was saying, that takes a really long time for them, just, you know, just waiting for the people or go out, and even for the people that are bringing them, because it's usually they're taking out of time of their day to do all this. The people that would take transportation, like public transportation and everything, one of the other things I would always say is like it also limits them the amount of things they could get because of the space that they can bring, you know, they can use on the bus stops and all that. You know, and there's also a lack of places that are nearby. So they either have to walk or have to rely on these systems that are not necessarily working that well for them. Uh, yeah, and then there's not also everyone has the accessibility of getting like food deliveries as well. Like, you know, like people do the Instacart or like CSA boxes and all of these things. And people are really looking for these close sources of food access and healthy food access.
Awesome. Thank you. So we moved, retrieving all this data from our informants across the community. We also wanted to talk to people about solutions, and this one has we have a little animation for you here just to enjoy. So, kind of reviewing the barriers that we found one more time, about, not close enough to stores, not having enough transportation. When we get to the store, it doesn't necessarily have the right cultural foods and the freshness and availability of nutritious foods in the closest store is usually pretty low. So we talked about strategies that we could have in different levels, right, in different spheres of power. And at the grassroots level, we want to be able to talk to our local stores and ask them to carry more produce. It's something that we can do, as consumers. It's something that we can do through neighborhood associations, and it's something that we can do through a vehicle like Food Policy Council. At the organizational level, so with people like Mill City Grows and Mill City Grows partners who are working in this food access sphere, we can work together to create new retail venues in places where those are lacking, or we can also increase HIP vendors. And we didn't talk about this when we were kind of defining our terms, but for those folks who aren't familiar, in the state of Massachusetts, if you are a SNAP customer, so the Supplemental Nutrition Program, you automatically have access to this other program that's funded by the state called HIP, the Healthy Incentive Program. And through that program, your family, depending on how many people are in it, can get between $40 and $80 worth of produce essentially free to you, in addition to your monthly SNAP benefits. The only catch is you have to shop at a HIP approved vendor. And these are always local producers. The only foods that are eligible in the HIP program are produce, so fruits and vegetables. And there are several communities that have many HIP vendors and a variety of places where people can go and redeem these benefits. And then, just as with every other resource, there are some communities who have very few, and the hours to access them may be very small. So increasing the amount of HIP vendors, the variety of HIP vendors, so folks who are producing culturally connected crops can also offer this benefit to their shoppers, and increasing the number of hours that they're available is really important. And then finally, on the policy level, there are some bigger implications here, right? Like improving transportation, so that folks who need access to, to buses can get that access, so that there's available bus routes in every neighborhood, and that the hours that they're running are longer. And specifically delivery programs, right? So there are not a ton of options for getting your food delivered for folks who have limited income. And one of the programs that we worked quite a bit with was working directly with Mass Access to provide, I'm sorry, not Mass Access, Mass Health, to provide home delivery of fresh fruit and vegetables to low income patients through that program. And so working within the systems to see what possibilities there are to get subsidized delivery of food. The second policy option is to really improve vendor incentives to accept benefits like SNAP, and to stock perishables. So what we found when we surveyed all of the convenience stores and bodegas within Lowell is that less than a third, I believe, stock any type of produce, and those that do generally have less than 5 varieties of produce. And so even if you're making best efforts, right, to get that fresh produce into your diet, there's still really limited opportunities to do that if your closest store is not stocking that type of.
Yeah, one of the things I wanted to add to that, like I was saying, in the Lowell context, right? Like, we at Mill City Gross, we are one of like the maybe 2 vendors that accepts HIP, and yeah, we're only available 16 hours a week, and the only other market that does it, it's like a couple hours on Sunday. So and at a very specific hour. So a lot of the times, most of our hours are during work hours, which not a lot of people necessarily have the time to like come during their work hours to to do their shopping and all that. We do have some markets that do go a little bit later, but yeah, so that it is also a barrier. Like the only times that we have the HIP available, it's on like a very specific amount of times and very limited hours during the week.
Right. We did have some success with this one this year. So
Yeah.
the largest farmers market in Lowell, which is seasonal, expanded their hours to, I believe, to 6 p.m. on Fridays.
Yeah,
Something
6
a lot of
p.m. on
customers
Friday.
were asking.
And we also have expanded a couple of our own markets too that are all the way up to 6 in the afternoon, just for that same purpose as well.
So kind of moving into like what these solutions look like on the ground, and particularly at the organizational level, we wanted to talk a little bit about some of the programs at Mill City Grows in Lowell and some of the changes that have occurred, in relation to the findings of the community food assessment, and also kind of in relation to feedback that Mill City Grows receives from customers all the time. So the first is the one that you're seeing over on the left-hand side of the screen, the mobile market. So this program, I believe, was started in 2014, 2014, and had a few stops throughout the different neighborhoods where there was not a full service grocery store. And this has expanded quite a bit over the years. So there's currently, I believe, 5 stops.
We're at 4 right now.
At 4 at with the mobile market through Lowell this season. But the each of the markets has expanded in terms of hours of availability. There isn't 2 indoor markets over the winter, so that people who have access to the HIP benefit can continue to get it over the course of the entire year. And the different types of produce that we offer at this market have really expanded as well, to kind of, as Enrique was mentioning, some things that aren't grown locally, like lemons, limes, avocados, and some tubers, to make sure that we were offering, all the types of culturally connected produce that people were looking for, in addition to the locally raised, sustainable organic produce that's coming from Lowell and the surrounding towns. And everything here is HIP eligible. So the majority of customers at the mobile market, I think 70 to 75% are SNAP users, or they're using WIC or senior coupons during the summer. The other that you're seeing here, so there's like a picture with lots of bags, and then James and Lubna, our team, created and are doing this delivery CSA program. So this has, I think, currently about 200 households that engage in this program. Almost all of the customers use the subsidy to purchase the food. So they are either SNAP customers, or they are part of the program I mentioned earlier with Mass Health. It's currently called Flex benefits. And I think that is going to be changing to something else in the coming years, as Mass Health is working on that. But the idea here is that folks who specifically, have are low income households. They have food security needs, and they would benefit in terms of their health from eating more fresh produce, are able to get it at zero charge. So there's no charge for the food that they're getting. There's no charge for the delivery. All of these are paid for through these different benefit programs. And that's been something that was started during the pandemic and has grown each year since. And, you know, I think it's the staff has been diligently looking for ways to make sure we can continue to grow the program, get the food to the people who need it most with no cost to them. And this is really helpful for folks who have like really low mobility, no access to transportation, would not be able to get to the farmers market on their own. And like many, particularly the mass health customers, 100% of them are diagnosed with some type of chronic illness. That's one of the eligibility requirements for getting into this program. So again, it's their health and well-being will be greatly impacted by having access to the food, and they wouldn't be able to get it otherwise. And then we wanted to talk a little bit about, you know, a different kind of food access point in terms of community and school gardens. So there are over 20 locations across Lowell that Mill City Grows has created community and school gardens. They're in neighborhoods where gardeners can apply for a plot, and then preference is always given to folks who live in walking distance from the garden and who self-describe as a low-income household.
Yeah. So
Yeah, Enrique was the manager of this program for a long time, so I'll let him tell you.
yeah. So yeah, like we have right now we have 8 community gardens that we do run, and these are like guided specifically towards residents, right? And if you were to look at the map that we did earlier, they're kind of actually located in between the areas where all those dots are. But yeah, so like we do focus on people that can actually like walk to these gardens. So like they're the main preference of what we do. And we're opening our 9th community garden actually on the other side of the river. Like I was saying earlier, this is going to be the first time we open a garden over there in like a really big lot. So that's going to add around 40 plus garden beds. So right now we have over about 220 garden beds overall. But then there's also the school program, which has their own garden beds, and they're kind of independent in a way. So there's actually some of the school gardens that they do serve as a community garden as well for members, families from those schools, as well as they get used for education. And those amount of, I think up to 21 at this point. We just built 2 new ones this year. And other food access programs that we have is for example, if you see that picture at the bottom left, we started this year what it's called the Supper Club, which is basically a dinner that we host, and it's literally like we contact members of the community who we know like cooking, and we ask them if they would like host 20 people so they can just have food. So it's literally just if you come and have food and you can go. So this like a way of creating that community space and gathering people, you know, through food, because it's really important. And also through education programs like our community garden program, they do have like an education element to it. For example, the picture at the bottom is from a composting workshop that they hosted recently at the library, because, you know, we do get a lot of people asking, hey, how do I compost at my house? How do I plan for the season and all that? So those are other elements that we do want to do that, and we make them all accessible at centric locations for our folks. Actually, like the library is like right in the middle of town, so it's kind of equidistant from everyone to get to on a Saturday. So that's kind of how we run all these things.
That's awesome. Thank you. And I think just one data point I wanted to share about community gardeners, which we found last year, is that on average, if you are a member of a community garden in Lowell, you are 50% less likely to have experienced food insecurity over the course of a year than the majority of the Lowell population. So this is a really intensive but effective intervention in terms of food access and food security. And I think the other thing I wanted to just say about educational programs is we have seen that having these in different spaces, like embedded within the public schools, virtually for people who can't come otherwise, with interpretation so everybody can join, has really created an environment where people want to talk about food sovereignty and want to be involved in the food system, and makes all of the other types of programming more successful because people really understand, the benefits of bringing their food system more local and being involved in it. So Enrique did tell us about this awesome supper club. This is a picture of it here, but I was hoping you could tell the group a little bit more about. So this is a kind of a grassroots level focused way to move the findings of the CFA forward, is by creating a local food policy council. So Enrique has been one of the catalysts to form the council, and has been working with the Community Food Partnership for several years now.
Yeah, so, like one of the main recommendations, like Jessica said, from the Community Food Assessment was the creation of a food policy council. Actually, our community didn't really have an actual food policy council really ever. We do have like a local commission that's on food and hunger, but it's not necessarily focused on food advocacy. So we started this food policy council, which it became known as a community food partnership, as a very grassroots-led group. And we are very focused on community members to join the group. So we are, all local residents. For most of them are, actually all of them are BIPOC members and or immigrants. And we are very focusing right now, on on the healthy incentives programs, kind of like Jessica was mentioning, and adding, for example, the more outreach partners, which are the folks in the city that can help you sign up for the SNAP benefits in general, because we found out as well that like Lowell, though it's like 100,000 plus people city, we only have like 2 outreach partners. So that means like very limited access for people to actually be able to sign up for these benefits. And we're also wanted to like work with the hip vendors and all that. One of the things we also were focusing on was in education. A lot of the members in our group are very focused on education, and actually how to eat healthier, where to get healthier foods, how to make these foods and everything. And that's part of like why the supper club started, and access to the community kitchen. So we are actually giving access to these folks to use our our kitchen, our big kitchen over here, so that they can start using that. And yeah, and that's kind of where we are right now. We also started these community food forums, where our pretty much events where people come and we talk about food issues in Lowell and see how we can move forward all these issues. We are actually talking now about on-house folks and how we can access food for them, because a lot of the times they don't even have SNAP. And there are new programs that are coming, for example, like the restaurant SNAP, but Lowell doesn't have any place or any restaurant that does accept the restaurant SNAP. The closest place is Lawrence, which is like far away for a lot of our on-house folks. So
Not walkable.
Not walkables, yeah. So it's not walkable. So we're starting to look into all these things and how to like, like get access to more people that, and sometimes people that, a lot of people forget about, so.
Thank you so much. So I think that this is our, kind of our final slide, and where we wanted to wind up with you so we can transition into question and answers. But, I think what we really wanted to kind of get across today is that there's so much intersectionality, I think, in everything. And what we really learned when we were studying the food needs of our community is that, walkability, transportation, the built environment are such a big part of food access. And so when we kind of went through, and this is just like the briefest highlighted version of all of the things that we saw as community-wide strategies to improve food access for the entire community. But I do think that there are things that could translate into almost anywhere. And so in terms of retail, the biggest thing, we saw people were looking for is diversity of produce available at every retail outlet and better distribution of retail outlets. So to really look at that map and see where we're missing that retail, to think about, what's the purchasing power of our residents, and are there ways that we can increase that for them, whether it's through local programs or getting more efficient use of federal programs. Community support in terms of increasing ways that we can improve people's fresh food consumption and their quality of life. So not just it's a food program, but how do we pinpoint the specific things that people are having trouble with? And when everybody in our community says they want more access to produce, how do we create programs that reflect that? Urban agriculture particularly is one that Mill City Grows is really interested in, because that is one of our specialty areas. So really figuring out how we maximize the space that's growing food, and how can we support urban ag policies for not just Lowell, but for all urban areas in Massachusetts. We talked about what kind of education people were looking for, and they said they really want practical training about, cooking food at home, making sure their meals are more nutritious, and gardening if they have the land resources to do so. In terms of infrastructure and the built environment, what we saw over and over again was that access to sidewalks, crosswalks, a really great school food program, public transportation that meets people in areas where they're furthest away from stores and gets them to those stores is really important. And then having things like community gardens within neighborhoods and a food aggregation facility that can really bring the best local food to the people in the community, were all things that, and it's a long list, so it's not like stuff that we can get done right away, but things that we can continue to advocate for in terms of working with our municipality. And then finally, creating a way to coordinate all the services that already exist. And so part of the role of the Community Food Partnership, our local food policy council, is thinking about ways to improve upon that. So I think, again, this list, I think, is one that can be really helpful in any community to think about, these are the things that really support a food just environment, and are there ways that you can improve upon them in your community? I don't know if you have any closing thoughts, Enrique, before we transition into Q&A.
I think that last sentence was beautiful. So yeah, I think that's kind of what's on my mind. Thank you.
Awesome. So that's all we have for you today. So we're happy to chat and take questions. Hi, Tyler. I just saw you. Nice to see you. But if anybody has any questions about Mill City Grows or the community food assessment, or any questions about data that you might have, we can certainly help you with those today.
Yeah,
I'll just jump in because nobody else is.
Yeah, you're gonna jump in. Yep.
Okay, thank you. Thank you so much for this presentation. It's always very informative. Greatly appreciate it. So I'm the statewide coordinator for the Safe Routes to School program, and part of what we do, Jessica, is we do student route mapping, and we've done some in Lowell. I'll give Lawrence as an example. We've done all the K-8 schools in Lawrence. Some communities use this as like a GIS layer on their ped bike master plan. Everyone uses it a little bit differently. But one of the things that we've, I use Lawrence as an example, that's been successful there is that the food pantries actually, during COVID, came to us and asked if they could use the maps to help, we're all trying to be age-friendly communities, just to try to designate the best ways to get to some of the schools, which were either being used for, emergency services, everything during COVID, in addition to food banks. So it's just another organization, service in your community, because they are active in Lowell, that might be something different to think of. Because these maps that we make, any map is a living beast, if you would, living creature. And we love to put landmarks on them, but we want everyone to use them. So as best we can, you know, with the school system's permission. We're all trying to do the same thing. It's all about connectivity and access. And, you know, food is definitely part of that equation, but you have to get from here to there to get whatever you're looking for. So whether it be a garden in a park or a communal garden or, you know, whatever the source might be. So just a different way to hopefully augment the great work that you're doing. So thank you.
Thank you.
Seth, you're welcome to go next.
Hi all, thank you for talking about your important work here today. You know, working in transportation, it's hard to think about any one issue without how it touches on every other issue. I unfortunately have to hop off the call early. I hope the rest of the Q&A goes well. I was trying to access the report that you all were talking about, and I couldn't find it on the website. So is there a way that I could access that?
Yes, let me grab the link for you right now.
Thank you.
Okay, so I'll put this in the chat for you, Seth, and anyone else who's interested. But if you click on there, there's a web page on the Mill City Grows website that talks about the CFA, and then there'll be a button if you'd like to download it.
Great, thank you very much.
Thank you for being here. And Karen?
Yeah, you're welcome.
Sure. So thank you for this presentation. It's really fun to hear all the work. Worcester has done a lot of work. Actually, there's a recent community food assessment that I usually attend these meetings as sort of the lead of a grassroots group, but I work for the Prevention Research Center at Mass Chan Medical School, and they assisted with the community food assessment in Worcester. But my question is actually really, I actually passed on information about this session to Regional Environmental Council, and who has a lot of work that's very much in parallel with what you all do here in Worcester, longstanding. They're actually coming up on 50 years, and their work is focused on food justice now. But my question was really about the networking part of it, is whether it seems like it would be a really great thing for you all to be connecting with not only REC, but, you know, the others around the state that, and maybe you already are. So I was just curious about, you know, on the transportation food nexus. So curious about that.
Absolutely. So there is, I think there are networks of, you know, all the folks who are working on this type of food justice work in Massachusetts and in New England, and then another network for folks who are in urban environments. We love REC. You know, we've partnered with them on a number of things, and I think a lot of what we did during COVID was very similar to some of the pivots that they made as well. And we were talking with them, I think talking with Grace there on a weekly basis, as we were kind of just sharing best practices and things that had worked and things that didn't work. But that it's true, that is an incredibly important piece of the work. And I think there's lots of ways that folks are getting together. And I think in the practical way of advocacy is really important. I think in terms of like larger food aggregation is really important too. So we want to keep as much of our food, you know, local and regional as possible. And if people, you know, some folks have an abundance, what are the ways that we can share it with each other? So I think that's a piece of the network that's a little more technical and something that we're continuing to develop. But I think, you know, also just in terms of being able to share resources and share our successes and share resources is really important. And I would add to, you know, we are part of like a USDA grantees that do community food projects. So Mill City Grows has been part of this network, and there's folks all over the country that do this as well. And the USDA brings that group of folks together physically for the first time last year since COVID, but once a year to talk about best practices and share information from the programs that we're running and some of the, you know, the obstacles that we run up against. And I think that those networks, with the exception of the USDA one, which you have to get a grant to be a part of that, are open for folks who are, if they're not yet part of it or starting a new venture that wanted to be able to be part of those networks.
Did anybody else have any other questions for Jessica or Enrique? Go for it, Tyler.
Awesome. Yeah, thank you both. Thank you, Jessica. Thank you, Enrique, for sharing. This is really great to hear about your work. I think I had a specific question around like the community garden plots that you have, and I'm curious how, maybe you mentioned it, but like how are you determining who gets those plots, and is that with like equity in mind? Are you thinking about, people in the community who ought to have greater access to food security who aren't, who are systematically disadvantaged, like, or is that just data you've collected from, I guess, just like how selective are you being about that? What does that process look like if you are?
Yeah, so on that end, we do, when people get into the garden, they have to file an application for it. And we do ask them some questions, when it comes to like, like the income and if they are on any benefits and all that. So we do focus on those folks as well, but we also focus on who's closer to the garden as well. So we kind of like go like both ways. We also want to make sure that the space is the same community space where everyone has the same access to it, but we also want to give access to those people that need it the most. So we look at everything, like some things outweigh each other depending on the person, right? So like so if someone like lives a block away and they like, they are on benefits or anything, but there is someone that like lives the same block, but they don't have, the economic needs, or they're like well off, we're gonna go with the person that has like more economic needs and all that. So we kind of like look at those things, and we balance them out based on what they put on their application and all that. But always trying to focus on who's like the closest to the garden. Like we do have people that like, we also give them a choice. So we do have the instances where like people may live across town, but all their family members are at the garden, and they are like, I rather garden here because that's where all my family is at. I want to like see them here, so this is kind of like a meeting spot for their family, right? But we do want to make sure that the people in the neighborhood are those that have the first, are, dibs from the garden pretty much.
So
And
it's like
Right.
is there, I guess just like what I'm hearing then is that for every individual application, you're reviewing it and sort of going through that criteria. And is that you and a team, or is that like, is there a committee of people making that decision?
Yeah, it's us in Mill City Goals, our community garden staff will look at that.
Okay.
And there are two people.
There's two people. Yeah.
We've also, in the past, and I don't know, this is season to season, there might be another community organization that wants a plot like for a group. So it might be,
Yeah.
like a new American support group, or a school, or a group that's doing work with folks with physical disabilities, and they're all going to share a bed together. And so those often have like a priority placement as well, because it'll be one bed that's serving multiple households.
Yeah, and then also we're not the only kind of organization too in Lowell that kind of has community gardens. There are like a couple churches, a couple other nonprofits that do have community gardens, and like we do have a wait list for our community gardens. So a lot of the times we do send people, hey, like by the way, we don't have like a space for you, but these folks may, because they may have just reached out to me like, hey, do you have any people on your wait list or anything? And we do kind of try to like do that with our partner organizations that do run their gardens, just to make sure that they do. I know like the Lowell Housing Authority, they have a few community gardens on their own spaces that we sometimes like, help, with like, when they have questions, we like tell them about like maintenance and some of these things. But they have their own community gardens as well. So yeah, but we do want to make sure, we do have a criteria that we follow through every time we're gonna assign a community garden, but also like where they're at in comparison to the garden is like one of the main things that we do.
Right. I did just share a link as well, based on what Enrique was sharing, that there is a kind of a policy for the city around community gardens. So we are probably the largest in terms of like operators and licensors of community gardens, but we're not the only ones, and there is a process to do so. So sometimes people would call Mill City Grows and say, "Oh, there's this wonderful plot of land, and I think you should start a garden here."
Mhm.
Because
Yeah.
it would be great for me. And we've frequently, referred people to this program so that if somebody knows of a vacant space, and they have, the ability to do so, they can work directly with the city
Mhm.
to set up a community garden there. And there's a set of regulations and guidelines and rules so that all these community gardens across Lowell will have equitable resources, right? And that there's not like the penthouse suite of community gardens and then like the under resourced, like they're all very much the same. The bed sizes are the same. There's somebody there that needs to kind of manage everything, whether that's a paid or a volunteer position. So that was something that when Mill City Grows first got started, we worked with some people in the development and planning department to help advocate for this policy so that there would be, I think our goal was not just that we would have community gardens, but that community gardens would be a priority in the city, and that this was something that, well beyond whatever the capacity of our organization could be, this was something that people could always create anew to satisfy whatever the current needs of the community are.
Yeah.
So was that like a bylaw that was passed, and were you a part of it, or did that precede you guys?
I don't
Yeah,
know
actually,
if it's a
no, it was
bylaw.
actually, yeah, like kind of create like, well, the community garden, I don't know if it's an ordinance or anything, but the guidelines for it were created with Mill City Grows and the city. So they didn't really have anything written down before we were formed, but so they actually originally came with us because they had a spot that they wanted to do a community garden. They asked us to kind of run it. So that's actually kind of like the origin story of Mill City Grows in a weird way. And yeah, so but yeah, like we did have a lot of hand in actually help in writing these things. We do have our own, like, obviously throughout time, we've changed some of our own specific guidelines, and because now we do have some spaces that like are not necessarily owned by the city, but if it's on city land, you have to go by that city of Lowell guidelines. But if you're on a private land, you can play around with it because it's private. But we still kind of like on ours, we kind of keep them all the same since, we're on a like, it's easier operationally, especially for a team of two to just like, keep it all operationally the same rather than select, oh, you operate different than this one, et cetera, because we have like 9 gardens,
I have one more question.
Sure.
I was curious so you mentioned that BIPOC residents have greater challenges accessing food. I was curious how you measured that. Was that like people's perception of their access, like their experience with access, or was that through some metric that you were?
So that there was a fairly decent sized survey that we did as part of the community food assessment. So that was the thing, that was probably the thing that most people engaged with. I think we had over 1,000 responses to that survey. We also did focus groups and some key informant surveys. So there's a few different sources of this data, but in the survey, folks gave their demographic information and then answered like this, standard food security questions, as well as a number of other, questions in terms of like where they do their shopping, how they do their shopping, what are some of their biggest concerns, about eating. Are there, do you always have food, right, is one. And then we kind of dove a little deeper and said, do you always have the type of food that you want? And so we wanted to really understand that nuance of like, there are many emergency food programs in Lowell. And so theoretically you could have an abundance of food even with no money. But it is not we wanted to understand if they were meeting the cultural needs of the community. And if people were eating the food that they were getting, or if they were receiving food that they didn't want to eat or they didn't know how to prepare. So that was kind of how we measured these different things, and there's a lot of detail like within the document itself. But those questions kind of went through these areas of affordability, and mobility, quality of life, and kind of like access to education. So we looked at all of these different things. And I think, some of the questions we asked were like, do you worry about food running out? Did the food run out? Do you have enough money to buy the food you want? Do you have, enough money to feed each person in your household enough food every day? And really kind of got nitty gritty with the different ways we asked that question. And all of the kinds of questions that we asked were really, we designed surveys and then talked with our steering committee about how we were asking the questions. And they were able to, before we got that survey out to, 1,000 people, think about if the questions were confusing, if they resonated with people, if they felt like we were missing the point, or there were further things that we needed to be asking. So I think that really helped us to figure out the different nuances in asking those questions. I hope that answers your question. I wasn't just like rambling. Thank you.
Nathan, did you have a question?
Yeah. Hi there. Great job on the presentation. My name is Nathan Lewis. I work for the Regional Planning Commission in Central Mass. So I don't deal with Lowell, but I am interested. I know you were talking about transportation issues in terms of access. And I was wondering if there's any efforts or pushes for more transportation access for like walkability, I suppose, to the city, or like trails or anything like that in Lowell that you know of?
Yeah, there's actually been a lot. I mean, we did lose a lot of bus routes actually for a while. But I help advocate. I'm also a member of another policy council, like a public health council, and we did advocate for that increased funding for like regional RTAs, the RTAs and all that. So that was like a big win. And I know like now Lowell is expanding at least some service hours when it comes to that. There's still like every year there's like something about adding more routes, because that's like a thing that Lowell has lacked for like for a while. And when it comes to like other like infrastructure transportation, there's been kind of like back and forth with like like bike paths, sidewalks, and all these things. But it's the biggest one right now. It's being mostly like through like a section from Lowell that connects to Lawrence and Methuen. That's about it. It was like about a project that they're starting to construct now, and that was kind of like the latest big thing when it came to like at least transportation and access. When it comes to bus routes, it's gonna be mostly like we need to get more bus routing that we had previously that we don't have anymore, and increased times. Yeah.
Do you have
Oh.
I think we lost Nathan for a second.
I might give him a minute. We are over our time a little bit, but didn't want to completely. There he is.
Hello, can you hear me?
Yeah, we can hear you now.
Okay,
We lost
sorry,
you
I'll
for
just
a
make it
Oh, it's
I'll just
okay.
make it brief. I guess my internet's not working well, but I don't know if you have data on your people that you work with and like their modes of transportation typically. I don't know if that's something that you look into.
Yeah, we do ask people, at least in our community garden program, for example, we do ask them like what is like their preferred mode of transportation. That's kind of like as far like as we go. The vast majority of people drive themselves. That's kind of like the one thing. Like we don't ask just to get to the garden. We just kind of go like, hey, what is your preferred mode of transportation? So that is kind of like our transportation like data that we have.
All right. Well, thank you everybody for being on this call today. Big thanks to Jessica and Enrique for doing this. I think you mentioned it's one of your first times doing this. Hoping next time we can have Johnny on board with us. We can do a part 2 or something. But Thank you guys and everything. I will be sending all the links that were in the chat to everybody later tonight, and then the recording should be live probably by midday tomorrow. So everybody's a great rest of the day. Thank you for joining us today, guys.
Thank you
Thank
for
you so
having
much, Emma. Take care,
Yeah.
everybody.
me. Bye.